Hi, everyone. I'm Esther Priegue. I'm a licensed clinical social worker and also Director of Behavioral Health Services at Doral Health and Wellness. And with me today, I have Giovanni.
Good day. My name is Giovanni Etienne, a psychiatric nurse practitioner working for Doral. I've been working as a psychiatric nurse practitioner since 2016 and specialize mostly in anxiety, depression, and various psychiatric disorders. We are here to present a wonderful discussion on dementia and caregiving. Esther?
Yes. So I'm just a little quick introduction. I'm a licensed clinical social worker, and I've been in the field now for 31 years, looking at different aspects of mental health and providing services from all different genres. And today we're going to be talking about dementia, giving, and the impact it has. And I do believe that everyone, even a family that's out there, that has not yet been impacted by this. And it's important for us to sit down and talk about why it's happening, how is it happening, and how is it affecting our families today. And Giovanni, can you give us a little introduction of what dementia looks like and what it is?
Yes, so it's dementia is not a single disease, but generally in terms of condition, it is caused by some abnormality or abnormal changes, and it does affect memory, thinking, behavior, and ability to perform everyday activities. It may mimic symptoms like Alzheimer's disease, which is most common type of dementia, and is also a progressive disease. And that's one of the reasons why we're here to talk about it because it's something that is progressive and it's chronic, and we as a team, we recognize the value of treating individuals with dementia.
Correct. And many families actually might be very confused with the two terms. What's dementia? What's Alzheimer's? And dementia can become progressively worse. So some people will hear, oh, does that mean I have Alzheimer's right away? So it's two different things, and I think we should discuss the differences between the two. But there is a lot of work now being seen by medicine that's done a good job in informing people of this diagnosis. You see more people talking about it than before. And by getting help with behavioral health services, it helps orient families, educate them, start discussing how it could impact them and how to prepare also in the future how to work with their loved ones with these issues. So now that we started talking about the family journey, when a family is told that this is a diagnosis, it could be quite difficult because if it's a spouse who's going to start making decisions for that person, or if it's a child make a decision for that person, because at this moment in time, that person has been deemed that they cannot make decisions for themselves, right? And that could cause a lot of issues. One, the family members themselves are in shock, possibly, because what do you mean I have to make decisions now for my parent or for my loved one, right? And that could be overwhelming, that whole shift, right? And then at the same time, since it's kind of physically hard to see dementia and Alzheimer's in a person, right? The person can appear to be doing very well, and then out of the blue, they may make a statement that may seem like there's something is finally wrong with them, right? So it can be confusing for them. And Giovanni, what would you say are some of the other emotions that happens to the caregivers and loved ones of dementia and Alzheimer's?
Thank you, Esther. You've touched on some of the important key aspect of it, but in addition, we find that individuals and their families feel guilt and grief, and especially if we're dealing with children with new onset of dementia, um, knowing that they're going to be trusting a different role and responsibility. The children and spouses need reassurance from us, and that's one of the reasons why we're here, and that's the support we provide within our scope of practice. In addition to that, like you just earlier mentioned, there's a sign of burnout and exhaustion caring for individuals with dementia, and because of, it's a progressive decline in the degrees in the disease process. And there's different strategies that are in place that we can work along with the families, such as directing them to respite care, rest, support. We offer within Doral Wellness, we do offer support groups for individuals and families who are in treatment to aid them in the journey of working with someone who has dementia, who is in the process of dealing with a new onset of dementia. Work along with the
That's right. And if we look at it, right? So imagine having your loved one who you've been interacting with for so many years and for almost all your life, and that person doesn't recognize you at one moment, right? That impact could be very harsh on the loved one. It's very difficult. And then you still have to take care of them.
Mm-hmm.
Even though they may be resistant to your care, they may be very oppositional to your care at that moment, or maybe even targeting you. Right? I had a patient that was talking about that just previously, where they were talking about how the person they're taking care of seemed to be lashing out at them the whole time, like a punching bag, right? So it is important that they receive services to support them, to lift them up. Because this work is not easy. It's very, very hard work, right? So helping them, develop them, helping them feel empowered, they have support. Someone to just talk about it, to be honest with you, is very helpful too, right? Um,
In my practice, Esther, what I have found in terms of caregivers and working with families who are caring for individuals with dementia, I find there's an increased risk for depression and anxiety and isolation within the community that we serve,
mhm.
especially as it relates to dementia within the family, and just gripping the idea that someone as young as maybe 40, early 40s now being diagnosed with dementia, so
Yes,
that impact can affect the whole family. And I find that there's an uptick in diagnosis of depression, anxiety, and isolation within the community of caregivers. Fortunately for us, we within Doral Health and Wellness, we offer counseling therapy, couples therapy, family therapy, and hopefully we can bring on board dementia therapy, dementia groups to help
mhm.
caregivers and their family to deal with individuals with new onset of dementia, and caregivers who are dealing with diagnosis of new onset of depression, anxiety, and isolation, which is impacting the overall family unit. This is very important. This is one of actually the very key points, the key takeaway for us dealing with individuals who have loved ones being diagnosed with dementia and is caring for friends and families with the new diagnosis of dementia.
Right. When I had a patient, I remember when I met her, and she had taken care of her loved one before they passed. And obviously, they suffer from Alzheimer's and at the very end of their life. And one of the things that we noticed when she came to my care wasn't just that the depression, but it was also because they had not taken care of themselves throughout all that time physically. They had not gone to any doctor's appointments. They were so busy taking care of their loved one that their own health started to decline drastically, right? And not only are they dealing with the grief of the loss of their loved one, but at the same time, they have to deal with the fact that they haven't managed their health, and their health has severely declined. So, getting self care, and that's a big term we use in behavioral health, self care, and finding ways to help themselves to manage the situation, to not become depressed. And a lot of the ways to do is individual therapy, doing support groups, learning how to manage the small quality time you may have in between taking care of your loved one, right? Because we have noticed it helps. It actually helps. And if you're in a better state of mind, then when you start to work with your loved one who has this diagnosis, you're actually able to do better in helping them. Support groups also take a moment and they start to define what it is. They may even answer questions that you didn't know about the diagnosis in the first place. And one important thing also is trying to remove feeling that the attacks are personal, right? So I've noticed that with many of our patients that they take the person's attacking me about this, and understanding that it's the disease talking, that it's not that person talking to you, right, and attacking them.
Esther,
Mm-hmm.
you strike me on the point of what you're saying, that there is this new dynamic within the communication within the unit. And
Yes.
what I feel, what I find was very impactful is the role changes within the family that is causing the tension, exactly what you alluded earlier. And this
Mm-hmm.
is some of the reasons that caused the family discourse, because of the different role changes and the dynamic. We as professionals, we do encourage open communication, compassionate dialogue, communication with the family, and
Mm-hmm.
being patient and working with the whole unit. Because, like you said earlier, it does impact the whole family, and the family goes through different changes. And sometimes it goes into depression, anxiety, aggression, lack of self care, like you earlier mentioned. And these are some of the key points that we picked up during our session in terms of the family unit declining due to the new onset, the new diagnosis of dementia within the family.
Right. And also culturally, in some of our cultures, we do believe, especially with families that we service here in Brooklyn, that that it's just old age concept, right? That they're just becoming old age and not understanding truly what it is that they're going through. But at the same time, we have to respect traditions. Some of our cultures believe that we need to take care of our loved ones to the very end, and some believe quite the opposite. You need to get them help. You may not be able to take care of them when they have that diagnosis. They may have to go into a facility, right? So talking about that in your therapy sessions or in group sessions with other families that are going through the same thing, getting information, getting support about it helps. And being able to manage and understand what to do next for the care of your loved one. Very much. And also another component is as an individual taking care of someone, right? It takes a certain skill, right? To talk to someone who has dementia and Alzheimer's. Um, it takes, I would say, most definitely an ability to handle that. I'm not sure if you ever been familiar with the book Notebook by Nicholas Sparks. And in that book, it's about a love story of this couple. And at the very end of the book, the couple are living in a nursing home because the female partner happens to have Alzheimer's. And he has to read to them every day their love story for her to spark to know who he is that's in front of her. Right? It breaks your heart to know that your loved one doesn't know who you are at all, right? So that person had so much grace to talk to him, tell his wife every day of their love story, just so he could get a glimmer if she would remember who he was. Speaking to him calmly, right? It's a skill. It's not an easy process to do. And it's hard. It's very, very hard. Also, someone who's grappling with that diagnosis, they're losing a part of themselves that they don't want to lose. Their individualism, the ability to, have control of their lives. And having this diagnosis takes that away. They don't get to have control, and they need the help of their loved ones to get through it.
One of the key points, and I actually was very pleased when you mentioned about cultural sensitivity and respecting individuals' belief, given the fact that we work primarily with individuals within certain zip codes. And there is a lot of stigma because I'm from the Caribbean. I can tell you it's an uphill battle just to get my family who is dealing with dementia to actually seek care because of their belief, the cultural belief, and the misconception of what mental health is, the treatment of mental health, and the services we can provide to our community. So, but what we're basically saying is that we get it, we understand it, but we do tailor our treatment to the individual cultural values and traditions. And that's very key. And that's one of the reasons why we're here to say, hey, we understand, we get it, and we are going to work with you and meet you where you are to help you along with your journey.
Definitely. And what does that team look like, right? A team that may work with you and a family could be a neurologist who may diagnose or may provide medication to the patient. And the family would have to administer that. Psychiatry as well, like Giovanni, the primary care doctor. There may be a nurse coming into the home to help. There may be a home health aide also assisting. Or the family members themselves are the home health aide for that patient. Right. It's also hopefully someone in the mental health field that would help out, either the psychiatrist or social worker or therapist that could help out with the family and to be able to help them, guide them through the process, because they're also watching their loved one be lost at the same time, little by little. It's the process of loss, and there's grief involved with that as well.
Yes.
It's a whole component involving that. And there are several, support groups out there. At Doral, we're looking to develop that group and get it going. And we know we've had some families identified already who want to be a part of that group because it's been hitting them home more and more every day. You know,
So we do
um,
have a collaborative approach within our Doral Health and Wellness. We have neuropsychiatry, primary care,
but
social worker that we provide therapy collaborative approach. Esther, this is your area in terms of mindfulness, group therapy, individual therapy, psychotherapy.
mhm.
So we support the overall individual. We do have licensed clinical social worker. She's right in front of us, Ms. Esther, our director of behavioral health. And we have a very wonderful team staff that works along with the individual on the joint dementia. We're saying we're here to help. We understand the community. We are the community. Esther, we do provide routine mindfulness activities, calming. I know you like to push helpful books that you always present every week in session for us to take a look. You always keep updating new evidence-based approach and what is new on dementia and what is new in therapeutic modalities we can help and work with the patient to help them along their journey. I said, do you have any other like takeaway that we can kind of push to our
Yeah.
community to say we're here?
Also, I think to add to that, Giovanni, is that one of the things that's important in the care of a loved one who has either dementia or Alzheimer's is there's also going to be some tough days, but also some good moments. And how do we do that? Incorporating the music that they like, their stories. Sometimes they will always remember childhood stories, right? That memory seems to be always more present, not the present, right? And connecting with that loved one, because sometimes there may be a moment where they can't connect with you, right? Showing them photos of themselves throughout their life history and of their loved ones and their family members. That process helps a lot in trying to help someone that's going through this, as well as the family themselves, right? So if you know Giovanni, someone who is caring for a loved one with dementia, we just want them to know that they're not alone, that we're here for them. And behavioral health department will definitely work with them in getting that help, and also to understand the journey. It's a journey, and we're there to help them, and we want to help them whatever stage that they're at. Either is that diagnosis or is it that just learning how to work with the person, as well as also taking care of themselves and teaching them themselves as caregivers how to manage that moment. And anything else you would say,
No,
Giovanni?
yes, we're pushing, we're saying not only the individuals who is dealing with dementia, but with their caregivers, could be family, friends, anyone who have any direct contact with individuals who is dealing with dementia. We're saying you may need help, seek us. Let's see where you are in the process, and let's work together to get you the help that you need in terms of dementia, caregiving, dealing with any form of psychiatric diagnoses. And if you also need any therapy, we are here at Dora Health and Wellness. We do provide these services, and we're saying check us out. Come on down. We're here to help.
The behavioral health team, you can reach us at Doral Health and Wellness at www.doralhw.org to learn more about the dementia support group and counseling services. And we also have staff that can help you connect you to community services as well, right? To be able to access those resources that you may need in the home to help you. And one of the things also is subscribing to Healthcare Unlocked. We'll be providing more resources and as time goes on YouTube, and follow us on Instagram at Healthcare Unlocked for more health tips, wellness tips, and updates on this. Because, like Giovanni just said, there is a lot of nuances in the field of dementia and Alzheimer's. We're learning more and more every day in the medical field how to manage these issues, right? And we have more information, and that's a good way to get involved and get more information by logging on and subscribing to Healthcare Unlocked on YouTube. We have some questions that are coming in to the chat here, and we want to be able to answer them. So, Giovanni, there's a great question here. What are the main differences between dementia and Alzheimer's disease?
Okay. So dementia is an umbrella term for a group of symptoms that affect memory, reasoning, and other cognitive functioning, focus, concentration, distractibility. executive functioning, in terms of long and short-term memory, recall, and it could be caused by various conditions, including Alzheimer's disease. And Esther, Alzheimer's disease is a specific type of dementia that is marked by symptoms of dementia, which is forgetfulness, poor short and long-term memory, focus and concentration. So it's marked by those symptoms. It's not a normal part of aging, and it is caused by the brain cells that affect their ability to communicate with each other in terms of the cognitive function of thinking, behavior, and feelings.
Right.
So,
And
but Alzheimer's is the most common cause of dementia. That's the reason why there is a confusion of what is Alzheimer's and what is dementia and what are the clear marcation of the difference between the two.
right. And sometimes, when you're in full blown Alzheimer's, that person may have no cognition at all, or not know anyone around them at all. There is not. So there is a differences. But you're right. One thing that Giovanni spoke about earlier is that we're seeing younger and younger people suffering from dementia. That out of the blue we're noticing there's an issue. That's something that's being followed. But what would be like an early sign of dementia in a loved one, Giovanni, that would show?
So you'll find a change in routine, forgetfulness, poor short and long-term memory recall. So you'll see a marked difference in the way they operate in daily layman's term. They forgot to write a bill or pay a bill, or they forget to call a family. They usually call their mom every day, and it becomes irregular. So you'll see a change in their pattern, in behavior pattern, and it's ongoing and becomes more and more consistent.
Right. So what I see with patients and families when we talk about this moment, when they start to recognize a change in their loved one, is where we don't notice that, for example, like you mentioned, they have not paying off the bill. Also, you see all their mail on top of the in their home, and no one's looked through their mail. They have stopped taking the medication consistently for some reason or another, where normally they were very good about taking the medication, now they're forgetting when they took the medication. And that doesn't mean that that's that issue, but it could be a beginning sign. When the patient starts to become very irritable, like their mood starts to really change in the person, when that wasn't their disposition in the first place, ever. But if you ask them questions about their daily living, they get very upset. What do you mean? They deny that they didn't remember something. They'll decline. But I would say that when would a family start to seek advice is when it's affecting their everyday functioning. That their life is it could be threatening to their care of their own living, or their loved ones, by the way. That too.
So you also find them in terms of trouble finding the right word in conversation. They would forget certain basic common terms like basic alphabetical common elementary terms. You'll find them forgetting what to say, and they kind of confabulate and says, "Oh, I forgot what I need to say," but that's just some of the signs that, and because it has been consistent. Also, what you says about the irritability, you will notice a marked change in their mood. They get confused, and you'll notice their judgment decline. They used to be at a higher functioning based on individual baseline, but there's a decline in their overall judgment. They may make some irrational or impulsive decisions. These are some of the key points that you look at, and then once you see these points, you need to consult your primary care doctor for referral to psychiatry for treatment intervention. But yeah, so those are some of the early key takeaway early signs of dementia that it's very prevalent, especially the short-term memory, recall, recent events, places that they used to like to go to, as much as basic as going to church. They forgot this Sunday. I normally go to church every Sunday, and then this is switch a change in the behavior. Those are some of the earlier key onset. So we
Mm-hmm.
want to look at individual routine and see what has changed.
Right. And this is a good question. How can caregivers support someone living with dementia while also taking care of themselves? So I touched a little bit about it earlier, but I'll give you an example. So, when you take care of your caregiver, your loved one with this type of diagnosis, or just in general, as somebody who's aging, you have to most probably be in charge of their their daily life skills in the sense of making sure that they eat, making sure that they get bathed, that they're their laundry, making sure that they're going to their appointments, making right things of that nature. So that's time consuming, very much so. So what are things that we can do to make sure they take care of themselves, the caregivers? And it would be one of the things that I would suggest is mindfulness practices that Giovanni was mentioning earlier that I do promote a lot in my therapy sessions, down to deep breathing. Like let's say the person just lashed out at you. How do you not lash back out? It's by having some control. And you can't remove yourself from the space, but you can control the space within you by just taking some deep breaths, count to 5, and then afterwards let it go and do it again and let it go. And then using some statements that reminds you that this person does not mean ill to you. In other words, this is the illness talking to you, not the person, right? And sometimes you may need to call someone and say, I need to take a break. I need to coordinate that with family, with support, things of that nature. Um, what would you say would be some common misconceptions about dementia?
It is culturally sensitive. The stigma. I said the stigma. It's dementia. It's mostly for older people. Age. It's
That's what it is.
age is down basically is
You're
one of the
right,
main
Giovanni.
misconceptions. But it affects. It could be affect anyone, but the evidence-based resources between 40s, early 40s. There's a new guideline there. So it used to be, oh, you're 70, 80, 90, and then most likely you're experiencing. That's not true anymore.
That's right. And can you age and never get dementia or Alzheimer's? Of course. It has existed that you don't, right? I also think that some people hear the diagnosis and they automatically assume they're going to die. That's a very huge misconception too, as well. That does not mean that. We've known people who live with dementia or Alzheimer's for several years, actually, right? So, or that person will never know who they are. We don't know. It doesn't mean they're going to remember it. They're going to forget everything. That's not true. Some of them will remember certain things. I remember visiting my godmother, and she was diagnosed with having early signs of dementia. And I went to visit her one day. She didn't know who I was, and the next day she knew exactly who I was, and had one little normal conversation with me, right? So that's part of the diagnosis. It's some days you will have some cognition that you'll know who the person is. Some days no, right? When my own grandmother, I remember visiting her, and I noticed if I visit her in the morning, it was better. But when I visit her late at night, it was not good. She had a hard time recalling things, right? So everyone is a little different. Every case is different, you know. Now, this is
Esther, also, there's a big myth. There's a big myth out there that I find that if anyone experienced memory loss, the first thing that says dementia. That's
yeah,
also a big myth.
good
I find
point.
that in my practice to be individuals, patients with different diagnoses, they would verbalize that they have memory loss, and they're like, "Oh my God, do I get dementia? Is it dementia? Do I need to see a neurologist?" So that's a big myth. That's a very is very high in terms of memory loss means dementia. In addition to that, like I said, unfortunately, not only older people get dementia, that's also
Yes.
one of our push. People with dementia become agitated, violent, and aggressive. Not all the times. It's not necessarily true. It's just a decline in neuromyelin in the brains, and it affects different people differently based on the genetic predisposition, and environmental, diet, and all these other factors. So no, if people with dementia they do not become agitated, they do not become violent. It
Right.
doesn't mean that it is true. That's a
Correct.
very and also one I'm thinking one of the other key factors I find in my practices, people with dementia, they're not able to live a normal, healthy life, and that is also a misconception. The individual learn new ways of coping and new ways of thinking to have a good quality of life. So, yes, they do enjoy life just like everybody else. They're just another person dealing with an illness that they are in treatment and that they're dealing with. So they are normal, they live normal, healthy life with the diagnosis.
Okay, now not this question, which I think many people, when they hear that someone of their loved ones have dementia, do they think that they may get it? What's the likelihood of that?
So it is genetically predisposed. I'm not 100% sure on the number, but I would think 75 to 80% of individuals who have had a first generation of family member with the diagnosis, the probability has increased for them to have the diagnosis, but it's not necessarily true. It's based on lifestyle factors.
Correct. Yes, yes. So it's not an automatic. Oh, my mother has it. I'm gonna get it. It's not an automatic.
Sure.
No, it definitely is not an automatic at that moment in time. Now, this question came up when someone with dementia becomes upset, or confused. How can caregivers manage the situation? And is that's what's called an episode? You know, there's going to be a lot of episodes. I hate to say, if someone has these type of symptoms, but I think a lot of the way to manage the situation is one, you have to take a deep breath when you're interacting with them, and just need to stay in an even tone. Screaming and yelling is not going to help. It may make it even worse, and may make the person more confused. Actually, and giving clear statements and consistent statements to the person. It is now time to eat. It is time for us to have something to eat at this time. It is 11 o'clock. This is when we do have our meal, right? Oh, it's time for us to take a bath right now. This is what we're going to do. We're going to go into this bathroom. We're going to take a shower. I'm going to help you dry yourself off. And now we're going to come back into our space. Into your bed. We'll get you dressed. Explaining things clearly in small steps is better, because anything more than that would also upset and confuse the person, right? Anything you want to add to that, Giovanni?
Yes, I just want to debate that just a slight little bit on second thought on the question you asked me previously. What are some of the factors that affect dementia? I did mention genetic predisposition and history of family member who, especially first generation, who has had a diagnosis of dementia, then probably likely it can happen. It doesn't necessarily mean it will. Also, environmental factors. If you are lived in certain demographic area, you're exposed to toxin, that can also be a factor in the diagnosis. And what's your health condition? What's your diet? What's your lifestyle? How are you eating? Are you exercising? What are other
Disposition.
predispositions that affect the individual? What other co-occurring diagnoses they have? In addition to dementia, you might have anxiety, depression, cardiovascular disease, obesity. These are all factors that age is the one of the most significant risk factor, but it doesn't necessarily mean that the younger generation, like people like in the early 40s, cannot have it. But the likelihood increases as you go older. You will
Right.
find that uptake of the diagnosis is present, and what we're saying is we understand these factors, and we're saying that we have a team of nurse practitioners, psychiatrists, social workers who are specialized and can deal with treating caregivers with a diagnosis of dementia. And also we have a psychiatrist on board who is qualified, a nurse practitioner, to treat individuals with psychiatric co-occurring disorders like anxiety and depression and mood disorders that come along with the diagnosis of dementia. We do refer individuals to a total comprehensive workup at Doral. We are multi-specialty. We do have primary care doctors, but if we feel like you need more in-depth studies, we refer to neurologists who can also work along with the provider to see exactly what additional tests or scans, MRI, CT scans that can be ruled in or ruled out in terms of the diagnosis and treatment process.
Right. And we have social support systems set up at Doral that can help them manage that process. How to make those appointments to get to those doctors, how to get them to those events, right? There's we also have Doral Health Home. They have care managers that can help a family out during that moment in time. And even and talking with the primary care doctor again, because there's a lot of questions that come up. Why do I have to go see this person? Why do I have to take this medication? Things of that nature. So again, communication is key. And one thing I want to emphasize before we end today is the fact that we want to get to caregivers and help them. Why? Because again, self-care. If you take care of yourself and you're already predisposition, Alzheimer's, right? Or you're going to in the family. If you're not taking care of yourself, right? Diet, physical activity, finding ways how to manage your stress, it'll make it worse for you. We don't want that to be the case. So that's how we're trying to work today and to try to help families, so they can be able to learn how to manage those moments and the stressful events that could happen. And we ourselves at Doral, we view ourselves as a family ourselves. We work with each other. We help you. We're here to give you that moment, that space to talk about these issues that are very private in families. And it's an honor for those that we have worked for and worked with, and we're looking forward to working with other families in the future to help them. Thank you for joining us on Healthcare Unlocked. We hope today's discussion helps shed light on understanding dementia and supporting those who live with it. Remember, awareness is the first step to compassionate care. I'm Esther Priegue, licensed clinical social worker, and Giovanni.
Giovanni, psychiatric nurse practitioner at Doral.
And we'll see you next time. We continue to unlock the conversations that matter most in healthcare. And if you found this helpful, don't forget to subscribe to Healthcare Unlocked on YouTube and follow us on Instagram at Healthcare Unlocked for more health talks, wellness tips, and updates. And practice your self-care.
Self-care.